All right, welcome back to the Elias Macko Show. The digitization of health records inside Quebec hospitals expected to begin on May 9. Two of the regional health boards, the CJAD as they're called, one for the north of the island of Montreal, one for the Mauricie and the Centre du Québec region, they're going to be the first ones to test out this new project. Now, Santé Québec says the implementation will cause a temporary scale back of non-urgent care during the rollout. Operations are going to be reduced by 75% starting today, then up to 50% a week later. So there will be some short-term pain here. I think there are questions as to whether or not this turns from short-term pain to relief or short-term pain to long-term pain in the system. So how are hospitals preparing themselves for the rollout, and is there excitement or concern about this digitization? Let's go to Dr. Raja Hatem, an interventional cardiologist at Sacré-Cœur Hospital. Dr. Hatem, welcome to the program.
Thank you very much. Happy to be here.
So, digitization, in this province, we've had so many fiascos involving digital projects that I think people get very cautious or concerned when we talk about it. How do you view the digitization of Quebec health records?
Yes, I think I share exactly what you just said. So in the past, we've had some, subpar systems that have tried to be implemented and haven't worked perfectly. I'm quoting, for example, the DSQ, which is the Dossier Santé Québec, which is the application we use right now, for example, to look at labs, medications, certain imaging reports. And the DSQ, although it works the majority of the time, when it doesn't work or it crashes, it really hinders our productivity and our workflow. So it's a mix of excitement and anxiety that most physicians and healthcare professionals are feeling in the coming weeks. We're launching on May 9th at 4 a.m. There's thousands of people who are working on this project within Santé Québec and the hospital systems.
Give me your best case scenario. If all goes well, what changes when it comes to healthcare in Quebec and how patients are treated?
So the best scenario is that we're going to have a few months of difficulty while we're adapting and transforming, but eventually in the long term, and by long term I'm probably projecting more than 6 to 7 months, we'll have way more efficiency in our daily workflows. For example, when you see a patient, instead of the patient repeating his history time and time again to all the professionals he gets in contact with, all his file will be in one system accessible to all the healthcare professionals, including the family doctors, the nurses, the physiotherapists, the nutritionist. Everybody will have access to the same information. And if that information is implemented and coded properly, then for the patient, there's less risks of mistakes, and there's better care overall for that patient.
For the patients themselves, will they have access to this data? Will I be able to check out my profile? Is that part of this?
Yes. So with the EPIC platform, that's the system that has been selected by the government, eventually the patients will have interaction with their own file. You'll be able to access your own labs, your own results. You'll even be able to book appointments eventually once the platform is better integrated. But we have to remember that we're only launching in 2 hospital systems to start. So It's a pilot project. And if the pilot works out, then we're thinking about launching nationwide.
So take me through why you're excited, why you think this could be something that could truly change the way we get healthcare in Quebec.
Yes. So the excitement part is really for, the day-to-day charting and, prescriptions, for example, instead of sending a physical piece of paper through a fax to a pharmacy, well, I'll be able with one click to send a prescription that's digitized to the pharmacist. The other good thing is that, as you know, a lot of my colleagues don't write very well. So all these problems of communication, written communication, are going to be alleviated by the fact that everything's computerized and the information will be clear and accessible to everybody. So this is what gets me excited. We'll be able to more properly collect the data. So, for example, have a better picture of the health problems in the nation. Once this platform will be nationwide, we'll be able to use that data to, for example, finance preventive measures or prevention more, depending on the burden of disease of Quebecers. So these things get me excited. Getting rid of the fax gets me excited. Being able to write my note in one application and not use 3 or 4 different applications as we are doing right now is getting me excited.
We're with Dr. Raja Hatem, an interventional cardiologist at Sacré-Cœur Hospital. We're talking about the digitization of Quebec health records. So, as you said, pilot project, 2 regions here. People are concerned, however, about the data. You brought up the data. Mm-hmm. People are worried about, their privacy. What do you say to those concerns that people have? Oh, now everything's going to be stored in a cloud, and other concerns that it's an American company, all that kind of stuff. What do you say to those concerns?
Yeah, so to be completely transparent, I'm a physician. I'm not an IT specialist, so I'm not very familiar with all the security data precisions. That being said, I hope that the people at Santé Québec who hired professionals and experts in that area have done their due diligence and have verified all these things. So that's my position so far. As much as a patient trusts me when he gives me his heart problems, I trust Santé Québec to have done their part. But it's true that there has been some concerns. Now, that being said, if you extrapolate that thought process to all, for example, the Microsoft applications that we use for all the government systems, the thing with the Cloud Act can apply to those as well. And we didn't do such a big thing about it. But it's true that, healthcare data is very sensitive, so we have to be extra careful with that.
And, of course, we can always talk about every system has faults, right? Like even the current system, okay, it's in a file folder somewhere. Well, how's that secure, right?
Exactly.
So we have to look at all the systems here. Can I ask you, do you know, are there any other jurisdictions, whether it's in Canada or in the U.S. or somewhere else, that are using systems like this with success?
Yes, so other provinces have launched. I think Ontario has the Epic system. I think Alberta as well. And, back in 2016, when I finished my training in New York City, I was using the Epic platform back in the United States. Now, that being said, the Epic Systems platform was really built initially for the American healthcare system, and honestly, it was built to really be able to maximize revenues for hospitals there, because their system is all for profit.
Yeah.
So it's going to be extremely important if you want this to be successful that our administrators listen to the people on the field and listen to our feedback once we launch. If we don't work hand in hand to optimize this platform to our Quebec reality, it's not going to work. So it's going to be very important to work in collaboration, with the FMSQ and the strikes and all that stuff. This was problematic in the past months, but now that we finally got an entente with the government, I think physicians are back to being fully invested in this. And we all want this to work. I mean, nobody wants a fax machine in 2026.
Yeah.
We want to finally jump into the modern era. That being said, we have to do it, slowly and carefully. There's not going to be a right way for it to be perfect. There will be a lot of problems initially, for sure. Mm-hmm. And it's going to take probably months before we get our stride and make it work efficiently and optimally for everybody. But I think that during these months of hardships, it's going to be very important that our administrators and our leaders in the hospitals don't be in opposition with physicians, but be in collaboration and listen to our feedbacks from us and from the nurses on the field.
Doctor, going to leave it there. Thank you for an enlightening interview on what lies ahead for Quebec Healthcare. Thank you for joining us.
Thank you so much.
That's Dr. Raja Hatem, a cardiologist at Sacré-Cœur Hospital.
Canadian women are looking for more out of themselves, their businesses, their elected leaders, and the world around them.
And that's why we're thrilled to introduce the Honest Talk podcast.
I'm Jennifer Stewart.
And I'm Catherine Clark. And in this podcast, we interview Canada's most inspiring women.
Entrepreneurs, artists, athletes, politicians, and newsmakers, all at different stages of their journey.
So if you're looking to connect, then we hope you'll join us.
Listen to the Honest Talk podcast on iHeartRadio or wherever you listen to your podcasts.